Hello everyone, today's video is about melatonin. Just before jumping into the video, if you wouldn't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I had yet another patient today who had previously tried melatonin and was having issues with insomnia, as is the reason why many people take melatonin. There are other reasons to take it, but that's the primary reason. And so, having sleep issues for years and years, tried melatonin, didn't help. So, so I spoke to this patient for the first time maybe 3 months ago or something like that, and said, "What's going on with your sleep?" Told me about their sleep. What have you tried? Tried melatonin, didn't help. And based on the kind of nature of how they were describing sleep issues, I thought, what, I think melatonin might actually be helpful. So, pushed a little bit or probed a little bit deeper, saying like, how much melatonin did you take? Sounds like they were taking around like 5 milligrams of melatonin. So I said, well, in my experience, that's oftentimes not enough melatonin, and could you, give this a try? And, my patients are generally quite affable and easygoing and, very, very lucky naturopathic doctor in that way. But I'd say probably 50% of the time, maybe 60% of the time, when patients have already tried melatonin and I recommend that they try a higher dose, I'd say 50 to 60% of the time, they virtually always do it, but I can tell they're kind of like, buddy, this stuff didn't work for me. It's not going to work now. Yeah, higher dose. No, melatonin just doesn't work for me. And while I certainly can't say that every time I've recommended that patients try a higher dose of melatonin than what they had tried previously, certainly not in every case has it been a slam dunk and it's made a difference. And I've, on a number of occasions said like, oh, it looks like melatonin didn't work for you even at a higher dose. You were right, I was wrong, that's fine. But I would say probably, good 80% of the time, maybe 90% of the time, the higher dose is helpful. It might not solve all of their sleep issues, but in many cases, the higher dose is of greater benefit. There have been many other supplements over the course of time that patients have been on, and a higher dose has not made a greater difference, but melatonin is a very, very common exception in my experience. So I just had a follow-up with a patient. She tried the higher dose and she's sleeping so much better. And so like it's made a dramatic difference. Like she's sleeping for 33% more time than she had been previously. So it's made a dramatic difference for her. And so she's so happy that she tried the higher dose of melatonin. So as per usual, I'm not able to give medical advice during these videos or health advice, any type of advice that might be construed as treatment. With that being said, I do feel that it's appropriate to mention, kind of where I get my dosing thoughts from around melatonin. And so I can't really talk about that fully without talking about some dosages. So again, please talk to your healthcare provider about melatonin. I don't recommend taking higher doses of melatonin. Certainly based on the content of this video, and it's really ideal to be supervised while doing that. Now, that being said, it's a free country. I mean, I guess people could be watching this in a place where it's not a free country, but generally, most of the places in the world, thankfully, are free countries. You can do what you want, but melatonin is a supplement that can have side effects for some people. So some people will just get minor side effects like feeling more groggy the next day or maybe getting some mild headaches. But some people start having, really vivid, unpleasant dreams. Some people have nightmares. Some people have night terrors. So while it's generally very, very well tolerated, it's something where, ideally one would have some medical guidance with that. So with all of that being said, the dosing for melatonin that I generally feel comfortable with my patients is going up to as high as 20 milligrams of melatonin before bed. Now, I don't start them at 20 milligrams. I have them gradually build up a certain way just to be able to look out for side effects or whatnot. But the reason I feel so comfortable with that dosage is because there have been many human clinical trials in the oncology realm using 20 milligrams of melatonin. That's the standard dose that's used in oncology trials. The occasional trial will use 30 or 40 milligrams, but the vast majority of them use 20 milligrams. And these trials are generally done over several months, if not a year or two. And so when I look at those studies and see like, oh, melatonin, not in every study, but in a number of them shows this in the studies, they're virtually always combined with chemo and or radiation therapy, but will show that the folks who are taking, chemo and radiation plus a placebo don't have outcomes that are as good as those taking the chemo and radiation plus melatonin. And again, some studies have shown no benefit to the melatonin, but a number of them have shown benefit. But for the purposes of this discussion, for just general, melatonin supplementation dosing, when you look at the side effect profiles in these studies, these folks in the trials are not, sprouting third arms out of their back. They're not, developing head to toe rashes. They're not having their hormonal systems completely being shut down by this copiously, massive dose of melatonin. They generally have, some of them do have side effects, feel groggy or headachy. And generally lowering the dose to an appropriate dose will solve that problem. But they're not having crazy side effects and hormonal disruptions and some of the different concerns that I've heard some people mention out there when it comes to taking higher than say 1 or 2 or 3 milligrams of melatonin before bed. So kind of armed with that information, I started recommending higher than standard dosages of melatonin for my patients for sleep issues. And as I cited earlier in the video, in many cases it's really helpful. So a lot of patients will come in taking oftentimes 3 to 5 milligrams, sometimes 10 milligrams of melatonin. And again, sometimes more is not better, but in many cases more is better. I've had some patients who have actually gone a bit higher than 20 milligrams, and sometimes that's been actually quite a bit better than 20 milligrams. In terms of the exact amount of melatonin that's produced in the human body every day, I've not been able to find any research literature telling us exactly how much is made because nobody's doing those studies, I guess. But when we extrapolate that data from animal trials, to my understanding, based on the calculations that I've done, I believe that the average person produces or utilizes at least around 400 milligrams of melatonin per day. Now, if you're listening to this thinking like, I heard a podcast or I heard so-and-so say there's actually, very little melatonin in the brain produced by the pineal gland, etc. Well, what is important to note with what I'm saying is that I'm talking about total body needs for melatonin. Melatonin is produced in the pineal gland in the brain, but it's also produced in the mitochondria of all of our cells. It's actually a really diffuse, really important hormone, essentially, that is not just for sleep. However, when we're taking oral melatonin, especially if it's like a sublingual type of melatonin, I should say, if we're taking melatonin, especially if it's just a regular non-sublingual, just a capsule or tablet form of melatonin, to my understanding, it has a relatively poor bioavailability. I believe we absorb a very small percentage of it, I believe something in the magnitude of around 1% or so. Sublingual forms that dissolve under the tongue, to my understanding, they're purported to have a greater absorption, but what it comes down to is the vast majority of the melatonin that we're taking orally, to my understanding, doesn't actually get into the blood, doesn't get past the blood-brain barrier, and so a lot of the melatonin that we're taking is going to be supporting other parts of our system, which is good because we, again, need that melatonin for our mitochondrial function. It's a really important antioxidant, so it's important for lots of functions, including protecting our cell membranes and our mitochondrial membranes, and melatonin is just, wonderful stuff. So anyways, point of the video was to say that melatonin can be so helpful, and if melatonin is something that a person has tried but it has not been wholly successful, it's worth having a chat with their clinician, maybe talk about what the optimal dosing might look like, and just wanted to share those thoughts today. So I hope this was of interest. If anybody has any questions on this topic, please feel free to post in the comment section below. If you yourself have taken melatonin and have any comments on this and you feel comfortable sharing on, it's just us, just you and me and everybody who might watch this video, but in all seriousness, if you feel comfortable posting your experience with melatonin, whether it's higher dose melatonin was great for me, or higher dose melatonin was terrible for me, or low dose melatonin worked better than high dose, or anything that you feel comfortable sharing, please feel free to post in the comment section below. I will take a look, and otherwise I'll leave it there for now.